My name is Warren. I represent the Association of Palliative Care Centres, which is a South African national body representing hospices and palliative care centres around South Africa. So I'm from South Africa. I live in Pietermaritzburg in KwaZulu-Natal on the East Coast. We have an office in Cape Town, and the Association of Palliative Care Centres functions to monitor the quality of palliative care services provided by our members in South Africa. At the moment, we have about 70 members, and part of my job is looking at quality assurance, looking at welcoming new members to the association. There are other objectives. We also have a palliative care education program looking at introductory level training in palliative care for professionals, social workers, caregivers. We have a certificate course in palliative nursing in conjunction with the University of Cape Town. There's also courses that focus on psychosocial care, bereavement support, and things like that. And then other objectives of the organization look at the monitoring of the services that are provided, basic monitoring and evaluation, and counting numbers and reporting and things like that. So the association has a long history in South Africa. So there's a great need for palliative care, and it's not just in South Africa. Part of this conference has identified the lack of access to palliative care in South Africa and Africa around the world. So part of what we do is we are advocating to expand the reach of palliative care. We do that through networking with the South African Department of Health. We do that networking with private healthcare, medical aids and things like that. But just reaching out or expanding the reach of palliative care is so important. We have limited resources. Funding remains difficult in the NGO world in South Africa, and the need continues to grow. So part of what we do is where we can, we facilitate the connection of the patient with a hospice or a palliative care center. In other places, we facilitate networking of the palliative care center with other care organizations that can support the palliative care that is needed in communities, large communities, metros, small towns, and things like that. So it really is about advocating for palliative care. And that is so important in our current difficult funding times. Yeah. So over time, we've had very good relationships with the Department of Health, and ourselves and other palliative care service providers in South Africa were instrumental in developing a palliative care policy at a national level. That policy is currently under review, and so we are involved in that. So I think as an achievement, that is a standout achievement. Other achievements are a set of palliative healthcare standards that can be used to benchmark palliative care services against. Those standards have been accredited by the International Society for Quality in Healthcare. But they are really practical and allow organizations to develop processes and policies that can have a direct impact on patient safety, patient outcomes, and enhancing the services that they provide to large communities, small communities, wherever they might be. So those are some standout achievements over the years. We've had achievements with funding and then funding changes, but I think that is common to a lot of charitable organizations around the world, and the dependency on donor funding is a challenge, and it's a challenge that we need to seriously engage in terms of expanding the reach of palliative care. As I said, this is my first visit to Botswana, and it is my first attending of a African Palliative Care Association conference. I have been very, very impressed with the organization, and the level of presentations have been superb, really highlighting some of the challenges that palliative care faces in in Africa. And I think for me there's been a few things that stand out. Palliative care education is really going places. So many examples have been shared of success stories in education in palliative care at all different levels, from community caregiver level to university degrees and things like that. I think for me been really important. And as we grow and develop people with palliative care training and education, so the reach of palliative care increases. The other standout for me has been the real importance of being able to tell the palliative care story. How do we take what we do and we present it to the public, to government, to the media, to enhance the awareness of what palliative care can do in the life of the patient's family, and the community. We had an excellent presentation yesterday, I think, on compassionate communities. Are we developing communities that are able to be compassionate to those who have the most need amongst them? And in our case, we're talking about people with a advanced illness of some kind. Cancer is the common illness that we talk about with palliative care. But palliative care has such a wide-ranging impact. Palliative care for cancer we know about, but palliative care in hospitals, palliative care for HIV/AIDS patients. There's such a wide range where palliative care has an application, and it just brings that humanity and compassion to the care that is provided, whether it's in great big tertiary hospitals or whether it's in little communities of 200 or 300 people. And that, for me, is the reach and the impact of palliative care.